Hello, my name is Jason Brandlin, and I will be presenting this brief infomercial on a current hot topic in public health, the opioid epidemic. In 2016, the Substance Abuse and Mental Health Services Administration, or SAMHSA, found in their survey that almost 11.5 million people reported that they had misused prescription opioids during the previous year. The Department of Health and Human Services found that in 2017, nearly 50,000 people had died from an opioid overdose. Over 2 million people live with an opioid use disorder. The majority of opioid misusers got their drugs from a friend, 53%, or from a healthcare provider as a prescription, 37%. This shows that drug dealers or pushers are not the issue when it comes to introducing these drugs into the communities. Opioids are a class of drug that come from opium plants. They are typically prescribed for pain relief, but can also be used to treat coughing and/or diarrhea. It is labeled as a Schedule II drug, meaning there is an increased likelihood of abuse and a higher risk of physical and/or psychological dependence. This drug exists in natural and synthetic forms. Examples of opioids include heroin, codeine, Vicodin, fentanyl, morphine, oxycodone, hydrocodone, methadone, and more. Opioids work with the body's nervous system by attaching to certain receptors and blocking pain signals from various body parts to the brain. Users typically get the pain relief they are in need of, but these drugs also have other secondary effects. These include feelings of euphoria and hallucinations, which may temporarily be a positive experience for the user, but the drug also has side effects like drowsiness, confusion, memory loss, nausea, vomiting, constipation, trouble with breathing, convulsions, as well as promoting other addictive behaviors. Due to the addictive nature of these drugs, it is very easy for people to misuse their opioid prescriptions. This happens when they use the drug for non-medical purposes or do not follow the prescribed directions. After prolonged misuse, users typically suffer from a weakened immune system and are at an increased risk for infection of their heart and/or lungs. Other long-term effects include body aches, muscle pains and spasms, increased sensitivity to pain, and more. As stated earlier, it is relatively easy for prescription users to become misusers. This is also true for opioid misuse advancing to full-blown drug abuse. Once abuse occurs, these individuals are most likely psychologically and/or physically addicted to opioids. As a result of this addiction, if users try to quit, they are often experiencing symptoms of withdrawal like nausea, lack of appetite, shaking, loss of sleep, and more. It is also not uncommon for opioid abusers to transition to use more powerful drugs like crack cocaine or crystal meth. If heavy abuse occurs with opioids, users can experience an overdose where their bodily systems begin to shut down and even death can occur. Risk factors for abusing or becoming addicted to opiates include previous mental illness and/or substance abuse, being unemployed, patients on Medicare, and even people living in poverty or rural areas. The National Institute on Drug Abuse started an initiative in April of 2017 to combat the opioid crisis our nation currently faces. This consists of 5 major goals, including improving access to prevention, treatment, and recovery services, increasing the availability of overdose reversing medication to high-risk populations, and 911 personnel responding to calls related to drug overdoses. Another goal was to strengthen public health data collection and reporting, support future research on the science of pain and addiction, and lastly, to promote the future advancement of pain management medical practices to improve treatment and outcomes for patients. People who are currently dealing with an opioid addiction are encouraged to seek counseling to receive some behavioral therapy on how to overcome addictive tendencies. Some individuals may require medication to help suppress their desire for opiates and to help lessen the severity of withdrawal symptoms. If people are using medicine to help them quit their opioid usage, they're most likely or should be using a combination of behavioral and medicated therapy. In extreme cases of opioid addiction, please call the National Drug Helpline at 1-888-633-3239 to receive the support they need and to find additional resources such as detox or rehabilitation center. Thank you so much for your time.